Okay, doctors, you should all be able to hear me. Welcome. My name is Dr. Kronk, and I'll be giving you the information tonight. And we're just going to share my screen, and we'll get started. I like to get started right on time. So we will get started here right on time. Okay. Okay, what I'm going to do is I'm going to run through a presentation. I will kind of qualify who I am at the end. Some of you know me, some of you don't know me, so I'll qualify myself at the end, but there's probably not anybody that has more experience with testing and utilizing and expanding this idea of alteration motion segment integrity than I have. If you've not heard of me, when at the end, you probably have heard of me, whether you know it or not. So what I want to talk about is tonight, what I want to talk about is the three misconceptions of alteration motion segment integrity. And I'll give you a kind of a fourth one tonight, because as you'll see at the end, I train a lot of doctors, I coach doctors, I bring imaging center technology, I'm bringing it into the country. We're launching some really cool stuff this year that I'll show you. I've been in the spinal ligament injury testing business since 2005. So I have a lot of experience with this. What I'm assuming that everybody wants to do tonight is pretty much what everybody talks about and likes, is you generally have health centers, and you want to have more injury business, more spinal injury business coming into your clinic. And then today, there's never been a more important time to do that. I don't have to tell you what the gas prices are, what the food prices are, what the inflation rates are, and the fact that patients are not going to have expendable income, that they're losing, $3,000, $4,000, $5,000, $6,000 a year just in paying for gas and food that they didn't have to pay for before. So there's never been a time. I don't care if you're a medical doctor tonight. I don't care if you're an attorney. If you're a DC, DO, DPT, it doesn't matter. You're probably here because you're interested in finding out more or learning something from me about a thing in the personal injury market or in the spinal injury market. And I'm assuming you want to use it in order to get better results with your patients, get better compliance, get more referrals from MDs, more referrals from lawyers, and to have something unique to kind of disrupt relationships in your local area. I'm assuming that you're here because you might want to understand, if I'm using alteration motion segment integrity, how does it influence my other relationships, my relationships with my patients, with pain management specialists, with orthopedists, with neurologists, with surgeons, and with attorneys, and even insurers. Alteration motion segment integrity is to me has been abused to some degree, because people think it's just some sort of a medical legal test. It's not that at all. And that's why we've been working with it for so long. So the first thing I want to start off with tonight is just, what is alteration motion segment integrity? Could have medical doctor, chiropractor, DPT, doctor of physical therapy that isn't sure what it is. Alteration motion segment integrity just means that it's alteration of motion segment integrity. So when we have alteration motion segment integrity, it's an excessive motion problem. We only have three injuries that the spine can have, because the spine's basically two tissues. We can break it, or we can cause connective tissue damage. Connective tissue damage to the support ligaments shows up as excessive motion. Connective tissue damage to the disc shows up as herniation on an MRI. Now, the market is drunk in love with MRI, and I love MRI too, but the disc is a very small portion of the ligament problem or ligament damage. So when you're looking at excessive motion problems, that's what alteration of motion segment integrity is. Now, the only place where you will find this term is in the impairment guides. But alteration motion segment integrity, I will show you, is also this. So if you had a surgical fusion, surgical fusion is an alteration of motion segment integrity. If you have the level of damage with your patient, so if I have a patient that has ligament injury that rises to the level of alteration motion segment integrity, I also have a potential surgical patient because the surgical guidelines say that that's the level of excessive motion that allows me as the spinal fusion surgery to do the spinal fusion surgery. So there's many ways. The injury is the injury. So we have 3 injuries: disc herniation, excessive motion, or fracture, or combinations thereof. Those are the injuries to the spine. Now, when you simplify it down that simple, working them up and being very, very professional and specific is very easy to do. Super easy to do. So most doctors that I'm familiar with they don't think alteration motion segment integrity, wow, pre-qualifier for spinal fusion surgery. Now, does that mean that everybody that has alteration motion segment integrity has to have a spinal fusion surgery? Absolutely not. As a matter of fact, in a lot of surgical guidelines, you have to have a 3 to 6 month conservative care failure before it's pre-authorized in general healthcare. So the information that I want to kind of impart tonight quickly, I don't want to waste any of your time, is give you some information on alteration motion segment integrity. It's not just something that's in the impairment guides, but this is the only place. This term originated in the AMA impairment guides. It came into place at first in the 4th edition of the impairment guides, and it's been there ever since. So that's what alteration motion segment integrity is. When I went to Google search it today, if you Google search what is alteration motion segment integrity, my article comes up first in the Google search. Now, that's an article that I wrote in 2010 when I was writing an article in Dynamic Chiropractic to say that alteration motion segment integrity was the biggest gift that the AMA ever gave the profession of chiropractic, but my profession has dropped, fumbled, squished, annihilated the opportunity that the AMA gave. Now, it's not gone forever. We can revive it, but it was one of the greatest things that it gave the profession of chiropractic, because it said the subluxation, the misalignment that the whole chiropractic profession is based on has a very high impairment value. So another way of saying that, doctors, is that it's validated as super, super important. Now, tonight in a half hour, I can't show you exactly everything that there is with this. If you start studying it, and I'll show you a little bit tonight, it's an amazing validation that very few doctors know about. So you can easily, if you Google it, you should come up with the same search, and then you come up with an attorney that says, hey, loss of motion segment integrity relates to the movement of 2 adjacent vertebral bodies measured in flexion and extension. So it's measurements, and the AMA came up with the measurements. The chiropractic profession did not come up with the measurements. The AMA did. Now, alteration motion segment integrity is not a diagnosis. It's not a disease. It's not an injury. It's an amount of motion that's excessive that comes from an injury. So it in itself is not an injury. It's just a finding. So if you were to Google search it and you basically bring up any of the images, it's going to show you all that you need to know about, like, well, how do you measure it? If you wanted to measure it, how would you measure it? Now, again, when I read this in 1995, and I wrote that article in 2010, when I read it the first time in 1995, I thought, wow, what a validation that the medical profession gave the profession of chiropractic with this particular thing. Now, one of the things that comes up a lot is when providers know a little bit about it, they want to go out, they want to get a software, and they want to do it themselves. I've been doing this since 1995. When I did it for 8 years in my private practice, I never did it myself. In those days, you could still hand draw on x-rays. It wasn't all digital like it is today. In most of the digital units, you don't have the ability to do it. There's only one system out there that I'm aware of, and it doesn't mean that I can be aware of all of them or that I wouldn't have missed 1 or 2 or whatever. There's one system I'm aware of that has some drawing capability in this, including the angular findings. But in my experience with it, and why I sent out for an independent study for 8 years in my private practice, is because I knew the findings were so significant. I wanted them determined by an unbiased, independent professional. So I chose the radiologist to do it. I knew that in the medical legal realm of things that I had a high amount of leverage with that. I could do a lot with that. I could, one, it's independent, so it's not biased. Remember, as a treating doctor, I'm determined to be biased. I would manipulate studies just to make it look bad, just so I could do more treatment. That's the perception of the insurance industry has on the providers. When the providers, if I'm doing my own MRI, I'm a chiropractor, doing my own MRI, it would look the same, right? So in my experience, and we'll Q&A afterwards, and you can ask me any questions you want to. So I have a lot of experience with this, but my experience, I do a lot of attorney presentations. If I ask an attorney, would you rather have the treating provider come up with this or an independent medical radiologist come up with it? It's always independent medical radiologists, because it makes it easier for them to work with that particular finding. So you want to work with somebody who's really good at finding this stuff. I'm the CEO of Spinal Kinetics. Spinal Kinetics is a national testing service where our board certified radiologists test for this. Now, people will say, well, gosh, you do all these, programs and everything else just to get people to use Spinal Kinetics. I'm going to tell you, as the CEO of Spinal Kinetics, I wish there were 20 national companies in the market today. And hopefully that comes fairly quickly, because we will do 20 times better than we currently do if there was 20 services nationwide in this. I have no problem competing. The reason why it's not there, it's a very hard service to produce. It's a very hard service to deliver. So that's why you don't see it in the future. You will. I'll show you in when I explain who I am at the end. You'll see. You'll start to see it in imaging centers and imaging services, because it's one of the things we want that technology to go out into imaging centers, because it's really the main injury that most people are dealing with. So I'm just going to take a really quick right now. So I'm going to go through a report. Now, an excessive motion report, you're going to see Spinal Kinetics. Spinal Kinetics has a trademark term called CRMA, Computerized Radiographic Mensuration Analysis. That's our trademark term. So we call it CRMA. When you get back a disc study of the cervical spine, it doesn't matter if it came from Allied MRI, ABC MRI, Yorktown MRI, you could get an MRI report on a cervical spine from any MRI center. And if you understood what you were looking at in an MRI report, it wouldn't matter which center delivered it. Excessive motion testing is really no different. The only difference is there's some softwares in the market right now where 75% of the patients have alteration motion segment integrity. That's because there's errors in the process of measuring. That is a false, that you don't see it. It's not that high. So there's falsenesses. You got to be very careful with what you're using if you're going to use something. So if I look at this though, I get very used to being able to look at a study. So right now up on the screen, this is just the front page of a study. I know I have severe craniocervical junction issues with the ligaments. I know that I have a grade 3 sprain finding. I know that I have pre-authorization levels of spinal ligament injury in this test. I know that if I have an athlete or anybody that's competing in any sort of contact sports with the neck, jiu-jitsu, kickboxing, football, I got to restrict them because I got national sports return to play parameter guidelines that kick in on this particular injury. If I have excessive motion that's in translation, in extension, I have a high rate of disc herniations also associated with that condition. I also have a rating of impairment and an impairment level. So I have a permanent thing that fits into the impairment rating guidelines. I also, if I'm looking at treatment guidelines, I have an automatic qualifier for a grade 3 or grade 4 injury in the Cruft treatment guidelines, which means that treatment-wise, I have up to 76 visits or more in a 52-week treatment duration, of which I'm probably not even going to come close to use it. But I have it as far as space. I have that immediately just from looking at this report. So I have severe craniocervical junction damage. Anything over 1.7 is pretty significant. I have grade 3 sprain findings, and I also have grade 2 sprain findings. And it tells me right away that that's what I have. The grade of sprain finding, anybody can pick up is if you have a grade 1 sprain, you basically don't show any clinical signs of excess laxity. Everything's within normal limits. If you have grade 2 sprains, you have abnormal laxity. And if you have grade 3 sprains, you have significant joint laxity. If I want to look here, this qualifies me for an impairment rating. Now, tonight, I'm not trying to show you, hey, how to quickly read these. I'm showing you that you should, when you get used to looking at an excessive motion report, you should be able to read it just as fast as you do an MRI report. But these reports have a lot more correlation in them to other guidelines. So automatically impairment guideline kicks in, automatically surgical guidelines kick in. Does that mean I have to refer the patient out for surgery? No. But it means that I have to know that it's there, and it's good to document it. And it's good to say that I'm going to do a functional rehabilitation program to stabilize that condition so that they don't need the surgical procedure. However, if my ability to stabilize this or anybody else's ability to stabilize this doesn't work, it goes up to the level of the spinal fusion surgery. Now, if I'm looking at relationships and I'm looking at developing relationships and I want to develop a relationship with a surgeon, wow, I've already set all the platform. I've already set it all the way up. Now, if you go to a surgeon and you say, hey, look at these surgical guidelines, they're probably not even going to know what you're talking about. If I said to you, hey, look at the ICA best practice guidelines that support what you're doing X-ray wise, 99% of the chiropractors I talk to have never seen those guidelines. They don't even know what it is. So a lot of doctors have never studied the guidelines by which they actually are operating. That's not uncommon. It's not uncommon in our profession. It's not uncommon in the medical profession. So knowing it is very powerful for you in your communication, but you may not go out right away and say, well, look at what I found. This is in your surgical guidelines. And again, this will make more sense as I go. It also is in athletic return to play parameter guidelines. So it immediately kicks in athletic return to play parameter guidelines. It immediately kicks in a 3 or 4 grade in the Croft treatment guidelines. It immediately, if you have excessive motion in extension, gives a high predictability for disc herniation. So now you don't have to be we just send everybody out for an MRI with whether you got clinical rationale or not, simply because your attorneys want that. Now you can drive it all with clinical rationale of exactly why you're doing what you're doing. Your professionalism goes up, your confidence goes up, your ability to be not worried about the fact that you're in a regulated industry and that you could get attacked somehow. When you're operating with guidelines and you're operating with consensus and you're operating with what the guidelines say, you're as safe as you can get. I mean, there's no perfect safety, but you're as safe as you can get. Now, that also tells you that, good, I could have a disc herniation. Anybody that's got a disc herniation right now, one of the things I look at and say, all right, if a doctor says to me, well, the patient's got a disc herniation, or they got 2 disc herniations, good. My first question is always the same. What are the supportive ligaments around the disc doing? I mean, are they shredded? Are they trashed? Is there a severe excessive motion around that disc herniation? Because if there is, it's a completely different disc herniation. It's going to treat longer. It's going to take more work. It's going to have a more future care need to it, whether it's paid by an insurance carrier or not. If I've got a disc herniation and I got support ligament damage and I got severe instability around the disc herniation, whether I settle my claim and I'm done, and now I'm going on down the future, I'm going to have a lot more care needs than the patient that doesn't have that. And I should know that. I want to work with a doctor that knows that so that I can actually be explained it, so I can do things that would be good for me to do in order to maintain my health as much as possible. So fallacy number one was, hey, should I do this on my own? I said, no. You want to do it. You want to find an independent, unbiased third party. Now, some of you are large enough. You have clinics where you're bringing in-house into a lot of different services. And if you're at that level, then yes, you may be able to bring it in-house because you're using independent providers within your system to do it in-house. But if you're solo, I don't recommend it. Now, should you lead with alteration, motion, segment integrity when speaking to MDs or JDs? No, this is one of the biggest problems I see people do. They start excessive motion testing and they run out and they show the attorney, oh my God, look at this, look at this. It's all they're looking at is Greek. They don't have a clue what it means, what it looks like, what it is. It'd be kind of like if you had the MRI guys, right? So MRI first came out, it wasn't designed for spine, it was designed for cancer and other things, right? So they said, oh my gosh, look, we can see the discs. So they started running around to show these reports to attorneys that they don't know what an MRI is, right? And now they're first, hey, look at this report, it shows how much damage there is to the disc. They don't even know what a disc is. So no, I don't lead with it. What I lead with is spinal instability. And when I train doctors and we teach doctors, and I teach doctors in a program I have called Smart Injury Doctors Program, we lead with excessive motion, with the injury itself, with spinal instability. That's the condition that excessive motion causes. If I want to talk about impairment with medical doctors, or if I want to talk, because a lot of times they don't understand it, the attorneys definitely don't understand it. I talk about, if I'm going to talk about surgery, alteration, motion, segment integrity, I'm going to talk about surgery because people understand surgery. At least they think they do. So if the attorney calls me and says, well, Dr. Kronk, how injured is the person? Well, the injury, and they have enough support ligament damage that they qualify for spinal fusion surgery. Oh my God, you got to tell me more about that. Now I can bridge them into other information, but I'm not leading. I'm not starting with alteration, motion, segment integrity. They don't know what it is. I'm not leading with impairment rating. They don't know what it is. Now, even a lot of doctors don't realize an impairment is an injury. The AMA would have been much smarter to just say, hey, the AMA guides to the evaluation of permanent body injury, because there is no impairment without an injury. There's not in any of the sections. Something has to be injured, attacked, traumatized, damaged in order to cause impairment. So all impairments are injuries. So I oftentimes, when I'm speaking with lawyers, say they're permanent injury guidelines. Permanent injury, wow, that sounds interesting. So I don't lead with, and if you've ever tried and you ran around to attorneys and you led with, I did try it initially years and years ago. You probably will feel like I felt. No one understands it. They don't understand it. So you don't lead with it. It's like you're speaking French and you're leading with French and they don't understand French. So why would you lead with French? Again, if I want to lead with something, I'm going to lead with, this is the medical necessity for the performance of cervical fusions, right? And there's information in here, none of which is on the MRI, none of which gets picked up on the MRI. So if I'm going to lead with an attorney, I'm going to lead with, look, we take care of the serious injuries that are picked up on MRI and the serious injuries that are not picked up on MRI. As soon as I say that, I have the attorney's attention. And why? Because they don't know there's serious injuries that can be picked up that are not picked up on MRI. They don't know that the cranial cervical junction ligament damage was very significant. Ligament damage, let's go back here. Very significant ligament damage picked up here can cause all of these symptoms. It's not picked up on MRI. Now, you can find some MRI facilities. I know one in New York that'll specialize in this area. But in general, across the United States, at an MRI center, you're not going to pick up ligament damage in the cranial cervical junction. You're going to pick it up on X-ray. And you can poo-poo x-ray all you want to. If you poo-poo x-ray, you're sort of poo-pooing yourself, because that's how you pick it up. These are serious, that's a serious amount of translation. That'd be like if you locked your knee, and now it hyper extended by 10 degrees. And didn't lock, it hyperextended by 10 degrees. You got to walk on that. That's what this joint is doing right here. So these are serious injuries. So again, I don't lead with it. I lead with other things. Because I understand I can circle all around alteration, motion, segment integrity. I can talk about spinal instability. I can talk about the symptoms. A disc only has 2 symptoms generally. If I go out to Medscape, a disc has pain and radicular complaint, localized pain and radicular complaint. How many patients do you have that come in with a spinal injury that have localized pain and radicular complaint, and that's it? That's all. Any other symptom is not associated with disc. You have headaches, visual disturbances. My eyes seem like they're not focusing right. I think I got some ringing in the ear, doctor, and my jaw hurts a little bit. No doctor in the world would go with just those symptoms and say, you know what we need to do? We need to send you out to an MRI and we need to get a disc herniation study. They wouldn't do that because that's not, that disc herniation doesn't cause those symptoms. Damage to the other ligaments does. So I don't lead, I lead with something that they know, the attorney knows or thinks they know, a disc herniation. So I'm going to lead with a disc herniation. Hey, one of the things we specialize in is we specialize in the serious injuries that are picked up on MRI, like disc herniations, and the serious injuries that are not picked up on MRI, because the MRI is not designed to pick up excessive motion. Damage to the support ligaments causes excessive motion problems. And when these excessive motion problems rise to this level, they kick in surgical guidelines. And this is what I'm stabilizing, doctors. This is what I'm treating. This is what my treatment program is going to stabilize. I'm a busy injury practice and I see a lot of these. So would I lead with that? No, I would lead with a lot of other materials. Hey, your clients may be more injured than you think. Right? And I would lead with information that explains that a disc herniation has a minimal amount of symptoms, but the other ligament damage that causes spinal instability has a significant amount of symptoms. And now you're working out both. I don't have to, there's, in my experience, and with a lot of doctors that I've coached, you don't have to explain a whole lot more. They get it. Okay, great. They understand the injury is the foundation of all benefits. It's the foundation of all claims. So in our program, and I'll show you how you can get some of these resources at the end, in our program called the Smart Injury Doctors Program, we have all of these things written up, all of these booklets done. They're downloadable. The person, I mean, you'd spend, just on these 4 alone, I'd say just writing them, putting together graphics and everything else, I probably spent 125, 130, 140 hours. You would too, if you write them from scratch. Plus you'd have to figure out what you're writing. So if I don't have alteration, motion, segment integrity, does it mean that I have a ligament injury that's not rateable? No, it doesn't mean that at all. You still can have a ligament injury that's rateable. Doesn't have to be to the level of alteration, motion, segment integrity to be rateable. And all you have to do is look in the impairment guidelines. I just have this is a 5th edition. This is called the DRE categories. If I have greater than 3.5 millimeters or greater of translation in the cervical spine, or a difference of 11 degrees of angular finding or more, different from the level above or below, I have alteration, motion, segment integrity, and it falls into this category. I also have a condition that falls into just about every surgical guideline there is for pre-authorization for spinal fusion surgery. Now, do I have to have it in all surgical guidelines? No, I only have to have it in one, actually, but it's in many. And have I pulled every single surgical guideline that there is throughout the United States? No, I don't need to. I never have needed to. So I haven't studied Aetna's, Blue Cross, the difference between United Healthcare and Aetna's. I don't need to. I just need to Google search, hey, spinal fusion surgery, pre-authorization for spinal instability. And I'm going to pull up guidelines. I'm going to pull up surgical guidelines, and I'm going to look at it and say, oh, this is what just exactly what I just showed you. You know, this is just an EV core 2000, I think this one says 2019, so this is a picture from 2019. I think the latest one they have is 2020 or 2021. It's the exact same thing. So now, if I don't have, though, ratable levels, so let's say I have 3.2 millimeters of translation at C2 and C3. Is that ratable under this category? No, it's not. Most ligament injuries are not dead on center. They're more to one side or the other, so they will cause asymmetrical range of motion. So if I have ligament damage that causes asymmetrical range of motion, this is the category. Now, again, this is not an impairment rating. I'm assuming tonight, this is not an impairment rating training. I'm just showing you that in the impairment guidelines, and when you really get fluent with this subject, it's so easy to put it into impairment guidelines, surgical guidelines, return to play parameter guidelines, treatment guidelines, so that I'm covered. And here's a nice thing. I don't have to argue with anybody. I just have to show them. All right, so let's get into the next one that comes up a lot. Can you adjust alteration motion segment integrity? Can you adjust this? This is super hypermobile. Got a severe ligament injury. Can you adjust it? What I used to do is I used to say, hey, raise your hand if you can adjust it. Keep your hand down. Well, let's just do that once. Raise your hand if you can adjust it. Okay, look at the doctors. Okay, there's sort of, kind of, hesitation. All right, can you adjust it? Well, here's what I'm going to show you. In 1915, the basics of chiropractic, and I'm gonna, when I say adjust it, I'm gonna go from doctors of chiropractic right now. Doctors of PT are already doing it. Doctors of chiropractic, the whole profession was based on this idea of a subluxation. Subluxation is misalignment or mismovement of spine that causes nerve interference, period. That's all it is. It's identical definition as a spinal instability, actually. And once you identify it as a spinal instability, it's very easy to work up. It's very easy to validate. And all the, hey, this isn't scientific and we're philosophy versus religion versus that, all that BS goes away. Because that's all it ever was, right? The truth of the matter is that this thing in 1915 was known to be caused by trauma. Falls, blows, strains being the chief factors. Hereditary weakness in the structure of some part predisposed by rendering that portion more easily displaced. Subluxations are never hereditary, but may be congenital through violent or instrumental delivery into the world, or may appear hereditary because they occurred shortly after birth through the effect of light jars upon the hereditarily weakened segments of the spinal column. They are always the result of concussive forces, never of forces acting entirely within the organism. They result from the contact of the body with its environment. Knew that in 1915, right? Now we also have this concept of chiropractic in the 70s got put into Medicare, and that was the first insurance inclusion that validated chiropractic and then opened it up to all of insurance inclusion. And at the time that happened, I went through it in the 80s, you had pretty close to insurance parity. Insurance parity meant that all services were covered. So when I graduated in 1980, all medical services for any patient covered anything that the chiropractor did. Whether you adjusted the person 100 times, 60 times, 20 times, 10 times, everything was covered. Just like if you went to the medical doctor, if you kept going and going and going and going, it was all covered. Okay, so it said there were, in order to get inclusion, and I apologize, I didn't realize this transition was in here. The chiropractic colleges came together and said, look, there's 17 different types of displacements of spinal subluxations that chiropractors adjust and treat. They gave static. Then they also gave, oh man, there's an old transition. That was when I was getting tricky. They also gave kinetic, hypo, hyper, aberrant motion, sectional subluxations, secondary to muscular imbalances, to structural asymmetries. But the thing I wanted you to notice, it's not just a hypomobility. So can you adjust it? Well, to go further, in the 90s, all the way up, in the 90s, all professions had to develop guidelines. They had developed professional guidelines. So the first professional guideline that was ever developed in chiropractic was called the Council on Chiropractic Practice. It's still there today. It was the first guideline that was concluded in what was called the Federal Government National Guideline Clearinghouse. The last time it was edited was in 2013. And in that, it said, the American Medical Association, its Guide to Evaluation of Permanent Impairment, says that means to rate impairment, impairment could be due to loss of muscle power or motor function, impairment due to abnormal motion of the spine, impairment due to motion, loss of motion segment integrity, greater than 3.5, greater than 11 degrees of angular finding. Impairment due to disc problems, impairment due to pain or sensory deficit. The above are all, in fact, components of the subluxation complex. So they fit right within it. Now, if a doctor asks me, can I adjust it? I always answer it with, can you? I don't know. I don't know where your skill level is. I don't know if you got rocks for hands. I don't know if you're probably shouldn't be adjusting anybody because you're that bad of an adjuster. I don't know. You're the provider. I can tell you this. It fits right into our X-ray guidelines. So in our X-ray guide, the big thing in chiropractic right now is, well, should we X-ray? Should we get rid of X-ray? X-ray, getting rid of X-ray will drop chiropractic into the role of a physical therapist, only there'll be a spinal therapist. And I'm not against anybody that doesn't want to use X-ray. I'm just against people that want to get rid of X-ray. I think it's a huge mistake. In our X-ray guidelines, it says that if we take X-rays, we're supposed to make a subluxation analysis. The chiropractic profession lost its way and doesn't even really have a standard way of doing that. No college teaches a standard way of doing it anymore. It used to be just in techniques. We're supposed to make a determination of the spinal health, including the presence of any soft tissue injury. Now, what can you see with a soft tissue injury? You can see and get a report on excessive motion. That tells me if I got a grade 1, grade 2, or grade 3 sprain finding. It also gives me an idea that I may have a disc herniation, which is another form of soft tissue injury to the spine. So it tells me a lot. I'm supposed to make an assessment of any spinal instabilities. That means if I got excessive motion at, say, C5, C6, or C4, C5, I got a C5 nerve, right? So if I got excessive motion at C4, C5, I got a C5 nerve. If I got a C5 nerve, I could do a muscle test to go, oh, wow, my deltoid grade 4, I got a problem with the motor part of that nerve. I have a spinal instability. If I have pain with that, I have a spinal instability. I also can call it a spinal subluxation. I'm supposed to make an assessment of any degenerative changes, accurately count the vertebra, and I do all this to develop the most appropriate plan of care for the patient. What are my plans of care in my guidelines? Goes right into the Croft treatment guidelines. So what I can tell you is if the chiropractic profession, my profession, wants to continue down this thing of you only adjust a hypomobile spine, you've knocked out the majority. You basically will take yourself or all of us out of the spinal injury realm, because the spinal injury realm is one of excessive motion, not hypomotion. So this is a doctor of DPT. Listen to what they say.
If I can say one thing, I mean, so much of how you've been able to communicate so many of these things, like, I mean, because it's like in when I went to DPT school, like they talk about how 90% of injuries are hypermobility, like, laxity somewhere, muscles and everything. Like those are all, like you said, subjective, but you have to find the root of the issue. And I think, out of all the courses, all the material, like this, the course and everything you put together has put everything in such a simplified way that is easy to follow along. And I think it's great. It's put together really, really well.
So that simplified way communicates to a patient, communicates to an MD, communicates to an attorney, communicates to everybody that you would communicate with. And the other thing is, the thing that causes acute pain from acute injury causes chronic pain. So when I go back to, if anybody wants to really understand this profession, this right here is what you are looking at wanting to understand. Trauma, injury, because trauma and injury are what cause the majority of problems that my profession is working on in the first place. So anybody that knows trauma knows also chronic and knows also visceral. So you can get into wellness. I mean, your understanding of injury, most wellness patients do not start out as a wellness patient. Most wellness patients don't come into a doctor of chiropractic's office and say, hey, look, I just want to be adjusted for the rest of my life because I heard it's really good to do. It is really good to do, but that's not where they start. They start with either a chronic condition that they have, or they start with an injury. So if I were to say, look, can you adjust this? Or I can tell you that I adjusted it for 17 years in private practice. I was in private practice for 17 years. I've adjusted since private practice. I've adjusted in my whole career. Without exception, adjusted them, never had an issue with it. Now, a lot of providers will not talk about that. Everyone wants to be, well, no, we're really safe because we're doing a diversified technique and we're adjusting a hypo and not a hyper. We're adjusting the C3, C4 that's hypo, but not the C4, C5 that's hyper. And I say, well, how in the hell can you adjust half a segment that's hypo and half a segment that's hyper? It never made sense. It never will make sense. It doesn't make sense. So the more that we understand what we're doing, the easier it is. So as I said, I kind of give you my background at the end. Obviously, I like to talk about the fact that I'm a father, a husband. Grandfather, I like now. I didn't, like, as you get older, you go, oh my God, I just don't feel it goes really fast. Licensed doctor of chiropractic, treated for over 17 years, was in the rooms a lot, 175,000 plus times. Myself, treating the patient. Developed 2 national spinal ligament testing companies, currently the CEO of a medical company called Spinal Kinetics. Very proud of that company. We're the oldest now, longest operating medical company in this excessive motion space. I developed a system that our radiologists use. I never thought I'd get into programming, and I'm not a programmer, but I run the programmers that program the program. Developed the first online spinal ligament injury training program for doctors and for lawyers. I'll show you that in just a second. Completed my law degree in 2013 and co-produced the first spinal excessive motion detecting AI for imaging centers. So one of the things with this kind of testing is it takes a long time. It takes a radiologist a long time to plot all the points that are needed to plot on the spine to do an assessment. That's why radiologists don't do it. That's why it's a hard company to operate. We brought in an AI that does that now and automates that process. So, instead of 10 minutes, it takes, virtually seconds for these things to be plotted. Radiologists still have to look at it. Spinal Kinetics, we have 2 radiologists that look at every single study. One that's adjusting the points and another that's validating the points have been adjusted. So we're very meticulous about the results. Now, before I go to Q&A, some of you may want some information. You may want some additional information, which if you're around, you may have heard of Smart Injury Doctors. You want to know more about us, you just go to Smart Injury Doctors, you hit Learn More, smartinjurydoctors.com, hit Learn More, put your name, put your email address in. Hi, my name is Dr. Crockett. And it's going to take you to an area that's going to explain a little bit about who we are, what we do. I'm on a very slow computer. It's not my normal office. You're going to see a lot of peers where this is their experience with our program. You want to grow. I think this is the best program in the market to grow with. Obviously, I'm biased.
Hi, my name is Dr. Matt Herba, and I'm here to actually just give a shout out to the Smart Injury Doctors program that I've been using for about 90 days. Can you imagine if you were dropped off in a city and you had no contacts and you knew nobody and you had to start doing injury work or start to get into your community? Well, I've been using the Smart Injury Doctors program with Dr. Kronk, and the amount of use for marketing is absolutely amazing. You know, before I joined, I talked to a couple of the people that were in the program, you know, because you never know. And I wanted to find out if it was something that was worth doing. And man, it's amazing. There's hundreds of videos, all kinds of resources for you to use to actually expand your practice. I bought a practice in Boston not too long ago, had no contacts and knew nobody. And just by utilizing the materials that are in the program, I'm able to expand and get into my community in a very, very short period of time. So if for nothing else, the materials that are in the program that Dr. Kronk and the Smart Injury Doctors program has, it's been so worth it. It's worth the cost of admission. It's probably worth double. So this is Dr. Matt Herba from Boston, Massachusetts, brand new practice, and we're expanding.
So that's Dr. Matt Herba. There's a lot of, let me get out of here. There's a lot of more, and we have a lot more even than this, than is up on that board. So these are doctors that are currently using and experiencing what they're experiencing as a part of using the materials. So is alteration, motion, segment integrity part of it? Sure it is, because it's a part in the injury world. But again, I don't teach doctors to lead with it. I don't think you're going to be very successful if you do lead with it. So you just go then to watch a program overview. You watch about a 40-minute program overview where we explain the program to you. And then if you want to schedule a consult, you just go right into our schedule. You can ask away the questions. You can ask questions about, you know, okay, what does this mean or what does that mean? And get out of there. Sorry, I got the. If you want to listen to a Smart Injury Doctors podcast, which I highly recommend you do no matter what, if you've never worked with us before or never anticipate working with us, go to the Smart Injury Doctors podcast. It's on Spotify, it's on Apple, it's on Google. Log in, listen to those. They're usually about 9 to 12 minutes long. And it's me just taking a simple topic and talking about that topic as it pertains usually into the injury market. We also have a Facebook user group that's free to join. It's private, where we give all kinds of additional information because we want you to check us out. We know that there's no program, there's no Mark Student, there's no Matt DiGaetano, there's no program in the market that's like ours because of the marketing materials that we have. And because of the fact that we're going to show you how to become very unique, tighten up your clinic so it's very unique. You have a very strong selling proposition to your market. And then a lot of materials that actually get that message out. So all I wanted to do tonight was bring you some information about alteration, motion, segment integrity, because I know that people have questions about that. I'm now going to open it up, though, to question and answer. And first, I'm going to stop sharing my screen and let's unmute. Okay, you should be able to, hold on. Let's go to participants. Chat. Okay, you should be able to unmute yourself. Do you have a question? You can either raise your hand or you should be able to unmute yourself. So just, all you do is go on the bottom left, unmute yourself and ask away. Good. So if you have no questions, it's totally fine, but it'd be great if you do have, I don't care what the question is. Yeah, go ahead.
Can you hear me?
Yeah, I can totally hear you, Richard.
I have on the PROs, I said, I'm using Craft guidelines. The reviewer says, I don't give a shit what you're using. And they still cut you off.
Yeah.
And they still, you still have AOMSI. They're like, you're shut off after 20 visits. I mean,
What do they do with your disc? What do they do with your disc herniations?
The same thing. They shut everything off.
Right. Okay. So you ready to quit?
No, you got to take them to the local magistrate.
Okay, good. All right. So you worked out a series to do that, right?
Yeah.
Okay.
But I'm just saying that they don't even use Croft guidelines.
Who is they? Richard, who is they?
The reviewer. When I say, are you using Croft guidelines? I said, no.
Good. So you had a chiropractic reviewer?
Yeah.
Good. All right. So
I don't understand why they don't use that guidelines. I said, well, I'm using the guidelines.
if they use the guideline, they have to validate your care.
Yeah, but they're not using it. They're using some other guidelines.
Good. So what guideline do you state in your documentation that you use?
Croft.
You state it?
Yeah.
Okay. So there are techniques that you can do to actually go to, is it like auto injury solution? Who's doing these reviews?
And it seems like they're just local guys, whoever, they're still, they kind of farm out local.
Okay, that's fine. But who's the company that's farming the work out to them? Usually there's a company. It's not your local mom and pop chiropractor is not working for Allstate.
Yeah, well, it actually is Allstate, but they probably do send it out to a company, because then I send my notes to that company. I don't know what the company's name. Yeah.
It's always right on there. It's right on there. Right on there.
I mean, it's been last year since I've been reviewed, but I understand there is a company. Yeah.
Okay, so you've only had one review in the last year?
In the last year, yeah. The other ones I've been fine with.
Okay, good. So here's what I want to tell you. When you're in the personal injury market and in that space, like I was in it for years, you're going to have reviewers that are insane.
Yeah.
So you either contest the review, which I did routinely, and then you contest, or you send it to the reviewing company, you send it to the actual attorney, and you send it to the insurance company if you want to contest. They're very easy to contest. And if you start contesting them, especially if you have a review or IME problem, it's very easy to get that problem to go away. So that's not a hard, what's hard is if you don't have, who does your excessive motion testing?
DRMA Pro.
DRMA Pro. Okay, so DRMA Pro, walk me through it. Do you do it? Who signs the report?
No, they sign it.
Who's they?
The doctor who's DMR Pro, whoever they have doing it.
Who's the doctor?
Well, they have so many different ones. It all depends whoever's doing those lines that day.
Okay, all right. So is a doctor licensed in the state? Is it a radiologist or is it a doctor? Is it a chiropractor? What kind of doctor does it?
They're probably chiropractors. Yeah, they're not licensed in my state either.
Oh my God, you're kidding me.
Yeah.
So if you have an unlicensed doctor that's not licensed in your state doing a study, are you billing for that?
No.
Okay. You might want to reconsider that.
So I think they're in Colorado. You send these out too.
Well, okay, but here's the thing, doctor. If you bill for something, you have to know the ins and outs of what you're billing for. Somebody just can't sell you an idea that you can bill for this. You have to know, is the person that's doing the study, are they licensed in your state?
Yeah.
If they're not licensed in your state, they're practicing either chiropractic or medicine without a license. You can't treat if you can't go to Minnesota,
right,
and treat patients, right?
Right.
Why?
Because you don't have the license.
Good. So if you're doing studies or somebody's doing a study, they have to have a license in your state, or it's not legal. Now, that you want to check that out. If you need to call me, and please, I don't want anybody to get in trouble, including the DRMA people. That's not my purpose. I don't care. I'm not even trying to compete with them. We're not even at the same service level as that. that operation. All right. But what I don't want to do is have people get in trouble with it. That's it. That's all I'm saying. So you want to, anybody on the call, if you're using, if you're using MRI services, you want that radiologist that's reading the MRIs in your state. It has to be state licensed. Now you assume that the licensing or the company is going to take care of all that for you, and they should. Like at Spinal Kinetics, you don't have to worry about is our medical radiologist licensed in your state. We don't do radiology services in states with a non-licensed provider in that state. It would be illegal for us to do it. That's what makes it hard for Spinal Kinetics to exist, is we have to have doctors that are licensed in every single state. In some states, we don't get a lot of business. So, you have multiple licenses. But the bottom line is, Richard, not to scare you, you just want to make sure that your people are, like, I'm not even sure. The safest thing to do, just get the findings. Don't bill for it.
Yeah, I'm not billing for it. I'm just saying the reviewer.
You're not billing for it.
No.
Okay, that's good. That sort of kind of clears you a little bit, but it doesn't clear them, which is still connected to you.
Yeah, I'm just saying the reviewer, he just doesn't use Croft guidelines, but you got
Okay, yeah, but let's go back, Richard. So if you basically, you get this test result, it's signed off by a DC.
Yeah, DC.
And then they bill for it.
Yeah.
So they're billing the insurance company for it, but you don't know if they have a license in your state.
I just give them the information.
Okay, you want to please just check that out.
Yeah.
Get it checked out. And like I said, if you have questions, you can call me. Please don't say, oh my gosh, I was on a Dr. Cronk and he's saying something's illegal. I don't think anybody on the call needs to be told that if a service is being performed from a patient within a state, it has to be performed from people that are licensed in that state.
Yes.
Okay. Carrie, Tyler, George, Matthew, Chrissy, Peter, everybody on the call would say yes. So you have these, the problem with alteration motion segment integrity is you've had these little companies pop up and, they sort of bend the rules a little bit. I'm not for that. Not for that at all. Does that make sense, Richard?
Yes, sir. Thank you.
Yeah, you're welcome. Okay, any other questions? Any questions on it? Anybody? If not, it's fine. Like I said, try to do alteration motion segment integrity and excessive motion testing is by far, we took the chiropractic guidelines that I showed you tonight and we incorporated it into medicine and into radiology a service platform that would be able to auto-identify spinal instabilities in spine trauma. And it was all based on the chiropractic guidelines. So those guidelines that I showed you, those x-ray guidelines, those are some of the most powerful x-ray guidelines in the world. They're really good. The chiropractors that developed them were really smart. We should all be really proud of them and back them because they're awesome. And that's what I have to say about that. All right, anybody else? Any questions? Just chime in if you have. If not, I'm going to say very nice to have your attention tonight. I appreciate it. Look forward to seeing you again. We'll have a lot of different little webinars on different topics here in the future. Look for them. I appreciate your attention tonight, and I appreciate what you do for a living. And I'm here to support you in any way that I can. Okay, thank you.